Hi, Sue. We've not met together for a while. The two wise birds. We've been a little bit of hibernation in the summer, but what have you been up to?
Wow. Yeah, you're right. We haven't been chatting for a while. So what have I been up to over the summer? I've had a bit of a break. I've done a bit of traveling around and that sort of thing. And I've also been working with lots of individual dentists on career development, career change, that sort of thing. How about you?
Well, I've had a great summer. I've been feeding my passions for painting and dressmaking. So I've had a number of really good projects coming on, and my allotment is just bursting with veg at the moment. And similar to you, I've been working with a lot of clients that are not happy in their career, unfulfilled, maybe not as you've been doing, working with them so they get out of dentistry, but working with them so that they fall in love with dentistry again. So, yeah.
And that's interesting, isn't it? I think part of it has come about because of the stresses and challenges brought up by COVID of working in dental practice and indeed working in medical practice as well. And I think part of it has been there kind of all along, and this has brought it to the fore as well. And I think you're right. I think we sort of do two different aspects of the same thing. Most of the people who come to me have already decided that they want to move away from dentistry, or they want to reduce their time in dentistry and start up another career in something else. Whereas I think you're doing quite different work with them, aren't you?
Yeah, so a lot of the stuff that I've been doing recently is about developing their skills.
Mm,
And I do really feel that we go to dental school and we qualify and we've only got half a toolkit.
mm.
That and we talk about driving, that you learn to drive once you've passed your driving test. And I think there's a little bit similar of that for dentistry, is that people learn to do dentistry once they've got their BDS. But unfortunately, so many of the skills that we need, people don't know that they need them because they were never even mentioned at dental school. So, particularly business skills, communication skills, sales skills, I'm really experiencing that because they were never mentioned at dental school or in their FD years, there's not this understanding that they're important. And yet, the clients that do embrace them are suddenly realizing, oh my goodness me, there's this whole new exciting world, fulfilling world of dentistry out there, that had they tried stayed the traditional track, they would never have discovered it.
I think that's absolutely right. And it's an interesting way of looking at it as well. And for me, it sometimes depends what practice someone's gone into in the first few years, maybe when they've finished their FD, if they've been lucky enough to get an FD place. So if you're in a practice where somebody is upfront about this is the business of the practice, this is why it happens this way, because this is our business model, this is how we set our fees. We don't just look at what other fees are being charged in the same city. We look at how our business works and how we want it to work. And we look at the best materials, the best staff, we train them in the best way, and that's how we then set our fees. But if you don't end up in a practice like that, how does someone then work out how to run a business in dentistry if you've got no skills in that area? Nobody's helped you with that in the past.
Well, that's the problem, is
Yeah.
that unless somebody's come across it, there are so many people running their businesses just on intuition
Mm,
without any knowledge, and it's stressful, it's so expensive,
mm.
and unless people know where to find people like you and me, they don't know. And I think there is also this culture within dentistry where people are ashamed to say they're struggling.
Mm.
And this, I suppose it's all under this whole mental health umbrella, isn't it? Is that many people are fearful of admitting that things aren't how they say they're going to be. And I mean, we see it on Facebook, all these wonderful photographs.
Mm.
But is that really the truth? And then we can people like you and I often pick people up when it's gone too far. We can rescue them or help them rescue themselves. Think that I'm really clear that it's not my job to rescue somebody completely. It's to be their guide so that they can take them to where they're going, because it's their life, their decisions, but let me show them the easy way to do it.
I think that's right. And one of my first questions to people is often, well, what do you want your life to be like? And there's often a bit of silence there. And they say, well, no one's ever asked me that before. What do I want my life to be like? They've often said, what do you want your practice to be like? What do you want your surgery to look like? But it's a bigger thing, isn't it? It's all about what do you want in life, and then tracking it back from that afterwards. Absolutely. As well. And it's okay to ask for help with anything. Somebody came to me the other day about clinical skills and said, I've actually realized that there's a gap in my clinical skill set. So is it okay to put my hand up and say, I need some help, I need to learn how to do this? And
absolutely. What
yeah, absolutely it is. And I was saying people will welcome you to say, yes, you've recognized that. That's brilliant. Now, how do you develop that? And then how do you make sure you keep up with that? And people are only too happy to help. So never be scared to say there's a bit of a gap in my clinical knowledge. It's okay to shout up with that.
Such wisdom to acknowledge that there are gaps in your skill set. Yeah. Absolutely. Yeah.
And it's the same with business gaps, with communication skills gaps, anything like that. It's okay to say. But the other thing I wanted to mention as well is, I don't think as dentists, we always realize what skills we've actually developed along the way. Often people will say to me, oh, Sue, I can only be a dentist because, at 14, I started doing my options then I did my A-levels, then I got to dental school, and I was focused so much on being a dentist, and now I am one, I don't know anything else. But along the way, we pick up all sorts of different skills, communication skills, strategic thinking, all those sorts of skills.
Problem solving.
There's all those types of things, not to mention risk management, health and safety, infection control. There's all those different sorts of things. And just before we press record, you and I were talking about cakes. Tell us what you said about those cakes that you'd seen earlier on today.
Oh my goodness me. There is a group on Facebook, Dentists and Cakes or something, I don't know. But my goodness me, those cakes are absolutely beautiful. They would be on Bake Off any day.
Yeah.
And so this goes back to the skills that we develop as a dentist. People think there isn't a link between cake making and dentistry. Well, absolutely there is, because dentistry is artistry as well as engineering.
Yep.
But it's having that eye for it and that fine motor control and these beautifully, intricately iced cakes. Yeah. Absolutely, our skills are transferable if we stand back and go, what's going on here? And I think that there is a danger that we box ourselves in with that title, I am a dentist.
Yeah.
And so instead of looking at the I am statement, I do, and let's start to unpick, well, what do you do? What do you do really well? And what can you do in a different field? So, I mean, you were talking about some of the clients you see, and we as dentists know about colors. Yeah. Would come as no great surprise to me for somebody who's passionate in that area would be a great interior designer.
Absolutely. And in fact, I've just been working with someone who's going to that at the moment. So yeah, there's so many different skills that we've got that we can use in dentistry. We can use outside dentistry as a hobby. Sometimes we can use them outside of dentistry to earn a living as well, depending on what we want to do. And I think it's finding those things that light up our lives. You say, oh, I'm really looking forward to doing this. I'm really passionate about this. It might be a crown prep. It might be somebody's scale and polish that you're passionate about. Or it might be, I can't wait to get home and make that dress or make that cake. There has to be something you look forward to every day.
Absolutely. And I think the question that is always really useful is the why question. Why do you want to be a dentist? Yeah. And I hope that question is asked at dental interviews. Why do you want to do dentistry? I rather suspect it's not. But that's a really important question for somebody to think about. And if it is just chasing the money,
Mm.
I would encourage you to go and do something else that it's easier to earn the money, because dentistry is hard work, and you've got to feel it here. You've got to love it.
Yeah.
Otherwise, it's too difficult.
And if somebody doesn't love it at the moment, Jane, but they want to stay in dentistry, what would you say they would do? Someone's either not loved dentistry from the outset, or they've fallen out of love with it now, but they want to stay in dentistry. What would you
Okay, and I
advise?
think that's really important. If they've fallen out of love with it, I would want to know where they feel stuck. And many people feel stuck because they're doing NHS dentistry, the routine,
Mm.
dull, chasing the UDAs. And they see visions of beautiful dentistry on Facebook and in the journals, and they want to be able to do that.
Yeah.
And yes, developing those clinical skills is really important, but as important, if not more important, is something like best choices, patient-centered best choices, the communication skills, the sales skills, because otherwise it's really frustrating. And you know what, I've been there myself, to go on all these wonderful clinical skills training programs,
Mm.
but then the patients still don't want the dentistry, so nothing changes. Whereas if we do both the clinical skills and the communication skills, like patient-centered best choices, then the patients will buy the treatment and we feel fulfilled again. We start to see our way out off that UDA treadmill.
Mm.
Now, some people may just want to do those things and have them run alongside. Some people may just want to move into a fully private practice. That's not for me to tell them what to do. But it does enable them to fall back in love with dentistry again, because they look forward to doing the treatments that they want to do. Yeah, so that's what I see. And that's what the clients tell me, that they fall in love with dentistry.
Brilliant. So we've got Jane helping you to fall in love with dentistry again, which I think is really, really important. And if you've decided really that it's not for you, there's me that helps you to find other roles and helps you with role applications and interviews and all that sort of stuff. So there's help out there for everybody. You're never going to get to a situation where no one's going to help you. Put your hand up, ask for a bit of help, and there's always someone there.
And can I say something, Sue, that you did say put your hand up,
Mm.
but we also need to invite people to put their hands in their pockets, because good advice does have a value to it. And in the same way that as dentists, we know it's really important that if patients want good quality care, they have to pay for it. It's the same thing with help, guidance, and support. If you want really good help, guidance, and support, you need to pay a professional.
On that note, then, we have been the Two Wise Birds. I'm Sue Boynton,
And I'm Dr. Jane Lelean.
and we'll talk to you again soon.
Take care.
Bye.
Bye. Bye.